Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain that you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma therapy to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Today's program could open up a new life without pain for you. To speak with Dr. Darrow, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens. How's your beauty today? Did you have a good beauty rest?
Oh, you're hilarious.
I know I am.
I do try every night to get 8 hours. I don't always succeed. How about you?
Oh, yeah, I love 8. 9 is even better if that ever happens.
Yeah, that's a stretch. So how are we going to help our listeners today get out of orthopedic pain?
Well, it's work that I've been doing for over 25 years. This radio show has been going on for a little over 20 years, about 22 years, since my twinnies were born.
Oh.
And, it's very simple work. That's why I like it. I'm a simple man. And it's simply, I am. I mean, I'm complex in one way and simple in another. I like my life to be as simple as possible. And the work I do, to me, the orthopedics, is very simple. And I was trained in orthopedic surgery during medical school internship. I did as much of it as I could. And then I jumped ship when I had a shoulder surgery on myself that came out bad. But I ended up doing a practice of what we call regenerative medicine. And back when I first started, we called it prolotherapy, meaning we would proliferate new tissue to grow in the body. And it was very, very, very simple back then. All we did is used concentrated dextrose, which is sugar water, mixed with a local anesthetic. There were other things we could use, like sodium moreuate and zinc sulfate. And I tried everything that was out there that I could think of to see if it worked on my body. And really it was my own sports injuries that led me on the path to doing now what is called PRP, or platelet-rich plasma, and stem cells. I've used both on my body. I've done regenerative medicine, as you listeners and my patients who are listening know, on both of my shoulders. And even after a failed shoulder surgery, when I learned about injecting myself, I did that and healed it overnight, believe it or not. It's not usually like that. I've been very fortunate because I've done my knees, my elbows, both shoulders, my right wrist, and had other friends inject my neck and ribs and back. I was a gymnast when I was young and pretty beat up. So it's worked on me. It's worked on me all over, and that's why I am a proponent of it. And that is why I love doing it, because it's something that works. Now, we have Dr. Randy Weinzoff, I see.
We do. Let's go to him.
Let's go to Randy Weinzoff. Randy, by the way, I'm going to give him a little plug here. Thanks for calling in, Randy.
My pleasure.
Randy and I had dinner last night. And
yes, we did.
And I was thinking, let's get Randy on the show because I refer a lot of my patients to Randy when I can't get good success on areas that what I do I don't think works for. And this will lead into a lot of great questions, too. So typically when people come in with what we call a radiculopathy, which means that nerves are pinched either in the neck or the low back, it can radiate down the arms or down the legs. And those are often cases where there's nothing I can do because it really is a nerve issue. And Randy has, I don't even know how to tell you how good he is at this, but he has a panache for healing these radiculopathies without epidurals or surgery. And the first one I sent to him was many years ago, and it was a Latino male. I don't know if you remember this, Randy.
I do.
Who had pretty much a dead leg. I don't remember his left or right leg. And you can tell the story, but the answer to it was he was pain-free. It might have been in one treatment. I don't remember.
Sometimes we get it done too fast.
Yeah, and I went over to see Randy and said, how can that be possible? Here's a guy who would have ended up having a back surgery, no question about it, because that's typically what we who do traditional medicine think is needed, right? So, Randy, do you remember the story of this gentleman?
I do. And the reason it seemed to
By
be
the
so
way, why don't you
complicated-
give out your office phone number now, and then when you're done talking about this, you can give it again. So hopefully people that have these radiculopathies
that's great. So the office phone number is 310-395-0260.
Say it again so people can write it
20th
down.
and Broadway in Santa Monica. We've been here for 34 years.
Tell us the phone number once more.
310-395-0260.
Okay. And what happened to this gentleman?
So the reason he wasn't getting better is he had such a massive bony misalignment. The bones were actually crushing down on the nerve roots.
Okay.
And as you know, the nerve roots are the electricity that supplies the muscles in the lower half of the body. So he had a dead leg. His muscles were shrinking down to nothing. And the epidurals weren't working because an epidural or any form of injection doesn't actually move the bone off of the nerve. You're essentially crushing down on an electrical cord. All I did was let the electrical cord work again, and now the leg had full electrical component, and the strength came back and the pain went away.
Is it true, is my memory correct, that it was one treatment, or am I making that up?
Well, the one treatment, the leg was probably about 85% better.
Okay.
We ended up just doing a handful of treatments just to make sure we made full correction. So we had taken x-rays first. Mm-hmm. We now have a perfect roadmap on what we need to do so we don't have to guess. And most of the time, it doesn't take much to make full correction.
Well, that's great, man. And I've had great luck. I've been sending people Dr. Weinzoff to Dr. Weinzoff for many, many years. And it's been a very satisfactory relationship I have with him. I know a ton of chiropractors. I used to actually have a partner who was a chiropractor. So I love chiropractic, even though I'm a medical doctor. I'm one of the few medical doctors that likes chiropractors for many reasons. One is they touch people, physically they touch people. If any of you out there have had a surgery, like a neck or back surgery, I would say 99% of you, the surgeon didn't even touch your body. They just looked at an MRI or X-ray and said you need surgery, and then the surgery didn't necessarily work. That's why they came to me. So, Dr. Weinzoff,
touch them.
Yeah, thank you very much for your input. Hopefully, you're going to help a lot of my patients. Just even talking on the radio to educate people to know that surgery is really a terrible option in most cases. That's my experience. I get way too many people come in.
Here.
Way too many people come in after a failed surgery. Okay,
right.
And there's actually a diagnostic code that insurance companies have, like failed back surgery. That means there are so many of them that failed, they had to make a diagnostic code for it. So, Randy Weinzoff, I take my hat off to you. I'm wearing my golf hat today. I'm going to tip it to you, and I'm going to give out your phone number in case people want to see Dr. Weinzoff, who is an amazing chiropractor in Santa Monica. His phone number is 310-395-0260. And God bless you, my friend, and you do great work. I've sent you so many patients, and most of my people I can help. Most of my patients I can help, but some with these radiculopathies going down the arms or legs, there's not a whole lot I can do.
Dr. Darrow is the best, no question about it.
Well, we like each other.
All right. Have a great day. I appreciate you allowing me to hop on real quick.
All right, great. Get back to your patients.
Thank you, Randy.
Thank you. Bye-bye.
Terrific guy. He's about 6'2", probably about 230 pounds of steel.
Wow.
And it's pretty interesting because Dr. Grove, who is the doctor in my office now, who is doing the injections and seeing patients, I'm more in the management field now. I brought them together for dinner, and it was like two titans together, two monster guys, and they were talking about their days as bodybuilders and all that, and they're both amazing doctors. Dr. Grove, I am so in love with, and I'm so grateful that you've come and joined me in my practice. And the patients absolutely love Dr. Grove, and he's been trained. He really has been trained better than I have, because I had to learn back in the day when there wasn't any training by intuition and using my own body to inject on when I was injured to see if it would work. So, Mike, we're going to get to you in 1 second. I just want to give out the phone number to the studio and our website and all that good stuff. So if anybody's listening and they want to call me live right now, the phone number to the studio, write this down, 866-870-5752. I'm going to repeat it for you, 866-870-5752. And it's strange. Regenerative medicine is not paid for by insurance generally. But Dr. Weinzoff was saying last night, well, how come on the radio show you don't tell people that their medical payments policies on their cars pay for this procedure? So I just never really thought about it. So there are certain types of insurance. Sometimes workers' comp will pay for it. Generally, the health insurance that you have, like Medicare and all the others, does not pay for this. So if you're interested in finding out if your insurance will cover this, you can call my office. There are people there right now. And if the lines are busy because there's too many people calling, you just leave your name and phone number. We'll get back to you. And for everybody that calls me now or calls my office, if you ask for it, we're going to give you a free book with the, I wrote it a few years ago. The foreword was by Suzanne Summers. God bless you, Suzanne Summers. And she's had this done on her body several times. I did her knees back in the day. Her son Bruce, her granddaughters have come in, and so she's been very explicit in her writings to cover me, and she wrote a chapter in her last book about me and about regenerative medicine of PRP, platelet-rich plasma and stem cells, and it's worked on her, and God bless you, rest in peace, Suzanne Summers, but we had some good luck on your body before you passed in getting rid of your pain. And her son Bruce was in after he was an avid road biker, and he had a lot of accidents. And I knew him because he lived next door to me, and sometimes he'd limp over, and I'd inject him on the sofa or on the floor.
Oh no, that's hilarious.
Yeah, I keep my goodies with me. We can do prolotherapy anywhere because it's just in little bottles of local anesthetic and dextrose. I still do it once in a while in emergency cases when we can't centrifuge blood or get stem cells. So what else do I want to give out? The website has videos of me doing these procedures, and it has a spot to email me on every page of the website. And the name of the website is www.jointrehab.com. That's jointrehab.com. And on that website, you can email me, and I get questions all day and all night. The first thing I do when I wake up is I answer them, and in between patients I look at them, and at night, usually up to about midnight, I'm responding to people. So I'm very committed. Dr. Grove is very committed. All patients have both of our cell phone numbers, and I think this is a treatment that everybody in orthopedics should be learning. It's a lot safer, a lot less invasive. It's very, very conservative. It's just injections. You walk in the office, get injected, and walk out. And you don't need anybody to drive you. You don't need any anesthesia, none of that stuff. And it's worked on every part of me that I've used it on over the last 25 years. It doesn't work on everybody. There are a lot of doctors who do this who don't know what they're doing. And like I say to anybody who I refer to a doctor, go to the guy who does the most. I think we do the most. I think Dr. Grove and I do the most of anybody in the world. I'm not sure of that. I've been told that. And then some people take anti-inflammatory medicines afterwards for headaches and stuff, and that blocks the healing response because we're creating a little inflammation. So ibuprofen is a no-no. A lot of times people are too overly active. You need to let the tissue heal. You need to let it grow. And then sometimes people don't get enough treatment. They think this is a miracle. It's not a miracle. It just makes sense. You inject, you create a little inflammation, and fibroblasts come to the area and grow some tissue. The stem cells become tissue. Platelets are structural for that. And a lot of doctors don't use ultrasound to guide the needle, so the needle and the solution doesn't even go to the right spot. So be careful who you go to. Don't be shy in asking doctors, how many of these did you do? Yesterday, day before, last week, last year. We'll tell you everything. We're transparent. We're not shy. If we don't know something, we'll tell you. And on the show today, if you call me in with a question, I don't know the answer, I'm going to say I don't know. So, Mike, thank you for being so patient. Your right shoulder is bothering you. Can you tell us how long that's bothered you for?
Yeah. Actually, I had two questions.
Sure.
If that's okay.
No, you have as many as you like.
The first question is really for a friend of mine, and the other question would be for me.
Okay.
I'm not. I know you don't do anything with the macular degeneration, but I know there's been research and advances in that. Is there anyone you could recommend?
If you do me a favor, yes, there is someone, but I have to look them up. If you do me a favor and you go to www.jointrehab.com and say, can you please research for me a doctor who can handle macular degeneration, I'll do a search for you, because I remember years ago there was someone who was very proficient at it, and I don't think I still have his information, but maybe I can find it. It's certainly not on the bailiwick of what I deal. I don't treat eyes. But this gentleman did. I don't think he was doing injections. I think it was another method of something or other that I wasn't familiar with because I'm not an eye doctor. But go to the website and just email me from there, and I will do a research for you. Okay?
Okay. And the other question is for me.
Sure.
Just recently, I was having some mild pain in my right shoulder, and what I was doing to maybe help out the pain a little bit was I was taking curcumin,
curcumin, yeah,
and some other supplements, and that did seem to relieve the pain. And actually, in recent times, the pain doesn't seem to be there so much anymore.
Okay.
But I wanted to see. I don't know what's causing it. I mean, it's still there a little bit, but not as much. And it was more annoying than hurtful for the most part. So I don't even know what that would be.
Okay. Is there any kind of sports activity or repetitive things you do overhead?
No.
Okay.
That's what was bothering me because some of my other friends said, "Well, have you been lifting stuff or lifting weights or whatever?" And I said, "No, none of that. Just came on."
All right, I hear you, Mike. How long ago did it start? When was the very first time you can remember pain in your right shoulder?
Actually, it was actually the beginning of this year, January of this year.
Okay. So people think when they have some kind of pain and they're not active and they don't remember an injury that they shouldn't have it and they can't figure out why they have it. But if you think about how the body works, we have muscles that attach to bone, we have tendons that attach to muscle and bone, and it's the body has a lot of little lever systems in it, okay? So a lot of times, sometimes people will say something like, I just bent over and now my back is spasmed out. How could that possibly be? Well, that's how the body works. It's a biological mechanism where something can happen where you can sprain or strain the enthesopathy, or the enthesis. We call it an enthesopathy when it happens, which is the attachment of tendons, ligaments, or muscles to bone, okay? And that's one of the most common things that create pain syndromes. It's unfortunately one of the most common things that people get operated on for also when they didn't need a surgery. So be very careful. If you have a doctor, excuse me, I got a cough. If you have a doctor who tells you need surgery, make sure you go to a doctor who touches you to find out where the pain is coming from. You can't look in an image like an X-ray or X-ray to decide if you need a surgery. We don't treat images. We treat the body. How do we do that? We touch it. We find out where the pain is coming from. Now, in your shoulder, there are many different muscle attachments and tendon attachments that can easily be sprained. The shoulder is the most mobile joint, right? It moves in a lot of different directions. So most people throughout their lifetime end up with a tendinitis or a tendinosis or a tendon tear or a labral tear in the shoulder. Now, I, for one, had a shoulder surgery in 1994 when I was doing orthopedic surgery. My boss did it for me during a rotation where I was studying with him. We were doing surgeries all day long, and it came out bad, okay? There was an MRI that showed that I had what he called impingement syndrome at the time, and it means that the acromion, the top bone of the shoulder, was longer. Actually, I remember it had a little osteophyte, which is overgrowth of the bone. I played a lot of tennis back in the day, and I had a really hard serve. So I created some arthritis, meaning that the AC joint, the acromioclavicular joint, had hypertrophied down into the supraspinatus tendon, all right? And so what this doc did is he put me under anesthesia, shaved off the bone, and cut a couple of ligaments. And when I woke up, my arm, the entire arm was swollen. I don't blame him for this. This is just the kind of stuff that happens in surgery. The whole arm was swollen like a balloon, and I had a fever, and I was terrified. I thought I had an infection. It calmed down over many months, but for about 4 years, I was still in a lot of pain. And I then learned about this technique of injections of PRP and stem cells. It was actually called prolotherapy back then when I was doing my residency at UCLA. And there was a 1-hour lecture on prolotherapy. And the doctor got up and he said, I heal 80 to 90% of my patients with prolotherapy. And I was so enthused that I went to his office and talked to his patients. And they said, this guy is God. You know, I've had surgeries, I've had misery, blah, blah, blah. And he healed me up. And I'm here for another body part now. So I studied this, and I did it on my shoulder and at home after work one day, and injected my shoulder. I didn't really know what I was doing back then. No one had exactly told me. I just injected the spots on the shoulder that hurt when I pressed down. And I woke up the next morning. I had complete range of motion, which was limited before, and I was pain-free. Okay? So at that point, I was very excited, and I started, I will say, practice. I was practicing on my patients, and meaning I didn't really know what I was doing, but it worked on me. I did my wrist, that healed up, and my shoulder healed up, and so I started using it on my patients. I tell them I don't really know what I'm doing, but it worked on me, and there's studies on it, and I think it may work on you. So it became a full-time practice. I stopped doing the steroid injections. I stopped sending people to surgeons, and I started doing regenerative medicine. Today it's mostly PRP, platelet-rich plasma, simple blood draw, and centrifuge, or stem cells, or mixing both together, depending. So I would have to touch your shoulder, Mike, to tell you what is going on, depending on where it is. Another good hope for you, if you have, did you get an MRI by any chance?
No.
Okay.
No.
If you did get an MRI, don't get nervous because you have a rotator cuff tear or a labral tear. Hang with us. We're going to go to the break, Mike, and I want to explain the rest of this to you because I think it's important and could save you from a surgery and help get you healed. This is Dr. Marc Darrow. Please call us live at the studio right now at 866-870-5752 or call the office at 800-300-9300. Thank you, Nita.
Thank you.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Joint Rehab and Sports Medical Center in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.